Welcome to Urban Renal Talk with Tamika.
And Steve, what's going on, Tamika? I thought I lost you there for a moment. Huh?
No, you did, but I felt my way back. I felt my way back. How are you?
Oh, pretty good, Tamika. How you doing tonight, babe?
I'm doing well. I'm excited for a guest tonight. This device is really needed.
Oh, absolutely. Guys, you need to share this video. If you're watching, if you get any and you got a catheter in and your doctor's talking about access surgery and you're like, what the heck is going on? Access surgery? Well, we're going to welcome back Dr. Tej Singh, MD, all the way from Silicon Valley near Stanford University. And Tamika, he's currently vascular surgeon at El Camino Hospital. And I know you wasn't on the last show, but he gave some great information. And at the time, his device, which is the Fist Assist device, wasn't here in the United States. It didn't clear FDA, but it was over in Europe or Asia. He'll tell you. But now it got the green light. October 1st, he's stoked that it's going to be available. And just to mention, Dr. Singh is the CEO. He didn't just make the device and say, I'm going to go back and let other people market it for me. He's involved in everything that goes on because he's the CEO of Fist Assist Devices, LLC. And another thing, Tamika, which is so cool about this, he thought about this 35 years ago while he was a med student or practicing medicine at University of Chicago. Now, how many of us in the medical field, when we, I know when I was a tech and a nurse, I tried to think of all kinds of things to help patients. What about yourself? So I lost my partner. She froze up. But wait a minute.
Steve, I'm here.
Oh, okay. I got you.
Yeah.
But you know what I'm talking about when we worked in it. Huh?
This device was a long time in the making.
Oh, absolutely. Absolutely. So I'm just so happy. Let's bring Dr. Singh on so he can share this information and let patients know how they can save their veins and not get multiple access. Because, Tamika, how many people you know got more than one access?
Too many unnecessary surgeries, when if they had something like this device, it could help make things better.
Absolutely. Before we bring on Dr. Singh, Tamika, I'd like to always acknowledge our sponsor, Kibo, makers of Renal. And before I talk about a brief topic on this, I'm just going to read the FDA disclaimer, because these products, which is a dietary supplement, but as a prebiotic, probiotic supplement, is not intended to diagnose, treat, cure, or to prevent any diseases. But this will help people with kidney problems. They've gotten fantabulous results. I'm using Lisa Baxter's word, fantabulous. Oh, it's giving you fabulous results. And actually, Dad Vice TV uses this product. So, I mean, it's great. With some people, it may work, and some people may not. Not everybody got the same gut. So, do your research. We got the information scrolling below if you want to do investigation yourself. But Tamika, let's bring on Dr. Singh. I'm so excited to have him because, I mean, he's down to earth. Now, Tamika, you know the field we work in. You know how doctors have airs. They look at, you got some doctors be wearing glasses and they stick down to their nose and they be looking at you like, you know, like they better than you. But Dr. Singh is not like that. When I first reached out to him, he was gracious enough to respond back to me and was more than willing to come on our show. So I'm just very humbled that he took the time out, because vascular surgeons are busy. He got a call while we was talking backstage. That could have been something he may had to go rush in to do some type of vascular surgery. So I'm very appreciative for Dr. Singh coming on the light. So let's give him the VIP intro, Tamika, and bring Dr. Singh on. Here we go. Hey, Dr. Singh, how you doing?
Steve and Tamika, so great to be here.
Oh, man, thank you.
Oh, so great to be back. Steve, thanks for the repeat opportunity.
Oh, man, thank you for just taking the time out of your schedule. I mean, a lot of kidney warriors, they don't get a chance to hear from a vascular surgeon. Basically, they see you, you know, maybe you come to the room when you're preparing them and telling them what's about to happen. You do surgery and you go into surgery, you do what you got to do, and you come, you look at their arm, whatever, or maybe somebody else. You may do the surgery and then one of your students or another med guy may go look at them, or you may go. But with that being said, why don't a lot of surgeons talk to their patients and just give them, you know, the 411 or what's really going on with access surgery, instead of just whisking them in, vein mapping, surgery, next person, vein mapping, surgery, next person, and then you may not see them again until something goes wrong with the access?
Steve, I'm going to start off the talk. It's a fanfistulous question. All right? Fanfistulous. Fabulous question. It's a very complex question. It will take years to get through it all. But let's talk about surgery. Let's talk about the type of people that go into surgery. Let's talk about vascular access. vascular access, you have to have a passion to do this type of surgery for your patients. And to me, as a vascular surgeon who does all types of surgeries, it's probably one of the most important surgeries to be done well. It's probably one of the most important surgeries to be done for the patient. And if you don't have the combination of skills, empathy, concern, and a global perspective to help your patient, you should not be doing vascular access surgery.
Wow.
True.
Wow. And I'm sure a lot of patients, I mean, all over the United States, I'm sure you're well known in California. I mean, East Coast, they got their own vascular people. Can you just share a little bit about your background and how this idea came up about a fist assist device? But first, let's just take a look at it so people get to understand. Just explain it and then go back and just share a little bit brief about your history and how you came up with this marvelous idea. I mean, there go the device right there, wrapped around someone's arm. Someone may think, wow, what's going on with this? This is like bulky, but tell us, how did the concept come up for that product?
So, Steve, the process, really, I was lucky. I was probably in the right place at the right time as a college student. I was at the University of Chicago. Originally grew up in Chicago after coming from India at the age of 2. I went to the University of Chicago. I was on the south side of Chicago. I had great mentors teaching me how to make fistulas in animals so that we could understand how the arteries adapt. But nobody cared back then to really focus on the vein. And if you think about it, when we talk about fistulas in people's arms, the arteries are important. The connection, the fistula is important. What happens the minute the surgery is done is that the vein is crucial. The vein is crucial. What I was doing these animal operations back in the 1980s, I would basically take these animals, and the only way I could check if my fistula was working was compressing the vein on these animals, rabbits, dogs, whatever we were studying. And as I compressed those veins got bigger. Only when I finished my training here in Silicon Valley and I became a surgeon and I started doing fistulas that my patient said, doctor, make my vein bigger. They want to stick needles in this. And I went back to those days. And I said, wait a minute. In my animals, if I opened and closed the vein, they got bigger. So then while I was making that analysis, in places like Slovenia, they were putting rubber bands and tourniquets on people's fistulas to make them bigger.
Wow.
So you got what's going on in Slovenia. You got my background in Chicago. You got me here in Silicon Valley at Stanford. I put it all together, and I get intellectual property on the Fist Assist device, the only external, wearable, battery-operated pneumatic balloon to open and close the vein, to make a vein bigger, to make a vein stronger. And of course, we can talk about regulatory and all that, but the stuff I'm saying is a global perspective of this device. There is no device that can do as much as it can on someone's arm in a comfortable, non-dangerous way than the Fist Assist device. Wow. Today, we are literally a week and a half away from the U.S. launch of the Fist Assist wellness device. Wellness to me means arm exercising, arm strengthening, arm enhancement, arm stimulation, all for the vein. Arm, vein, everything. And that's the first path in the U.S. for Fist Assist, a wellness device. In the near future, it's going to be a venous increased circulation device, and eventually it's going to get to the FDA clearance level for dilation. And you're going to love this when we come back in about 9 months and hopefully say we can put this on a fistula in America. Right now, in India, in Europe, and in Canada, and in Australia, and in New Zealand, you can put the Fist Assist anywhere on your arm, before a fistula, during a fistula surgery, after a fistula surgery. We are now entering the American market as a wellness device, and this is super exciting that the first time we're announcing that is on your show with Urban Renal Talk with you and Tamika.
Oh man, that's awesome. Tamika, isn't that awesome?
Yes.
When we started off on cell phones, now you got well-renowned vascular surgeon CEO giving breaking news on their product on our show. Oh, let's take a look at that.
Yes.
Here it is.
Yes.
I got two versions here. I got the version that is available with just a simple band, and you're going to love this, Steve. This is the athletic band. A little bit more support. You could jog with this thing on. And
man.
It's basically a pneumatic balloon right there. That's the balloon. That's the intellectual property that makes this fit. This will go up and down. It goes to a pressure for the wellness device of 30, holds at 30. It's kind of like, you know, you watch basketball players. They got the arm sleeves on, Dwayne Wade and all those guys.
Right.
They're compressing their arms so they don't get edema. This goes up to the same pressure of 30. It lines up with your thumb, so it compresses your cephalic vein. And what you're doing is you're exercising your vein. You're opening and closing your vein while you're doing your work. You're strengthening your vein. You're making it enhanced. And when you're doing that, what you're doing with intermittent open and closing is you're changing the flow patterns and you're changing the big word of the night, nitric oxide levels. And the minute you start changing nitric oxide levels in your veins, they start to dilate. It's common sense logic.
Now, Dr. Singh, let me ask this question to Tamika because I know you got some questions. Dr. Singh, with that being said, why do surgeons just tell patients to use a tennis ball or find something to squeeze to dilate their veins? Why isn't maybe the promotion of maybe putting a tourniquet on your arm like the people in Sylvania and keep exercising throughout the day? Why is that not promoted a lot more by regular surgeons? I mean, I don't know. I'm not in the office, but patients have a lot of issues returning back and multiple access failure.
Steve, it's many levels of problems. You got basically the doctors, the nephrologists, the surgeons, the primary care doctors who don't understand that. Do you know in this country, nobody really, really ever cares about arm veins? Just think about it. I'm a vascular surgeon at some great universities. Do you think anybody ever pulled me aside and said arm veins are so important? No, nobody cares about arm veins. But you know what? 30 years of being a surgeon now in this country, I will tell you that arm veins are so important for blood draw, for chemotherapy, for PICC lines. And tonight we're talking about renal care, for fistulas, for blood draw. So what can we do to make arm veins bigger? Well, the science says the more hand exercises you do, you're increasing blood flow. You start doing a lot of hand exercises, your arm veins are going to get blood flow because your hands are demanding blood flow. So those people who are horseback riders, those people who are gardeners, those people who are carpenters, look at their hand veins or their arm veins. They're big. All right. Now, let's say you start doing gardening. You say you start working out. You're a golfer, whatever. Now you put a tourniquet on and you pump it up to 30. Your blood is coming to your fingers. It's got to go back, right? Now, if it's not going to go back, what's the vein going to do with all that blood? Stretch.
Wow.
When it starts to stretch, it's got a hold. What is the number one place where most of our blood lives? In our veins.
Wow.
The capacitance, the venous system holds so much blood. The arteries pump it. The veins got to hold it. You put a tourniquet on my arm and let me go out there and hit the tennis ball a couple times, my veins are going to be engorged. But how many people are going to spend 1 hour a day squeezing this? Unless you're going to be doing this, you're going to say, are you got a nervous problem? Are you anxious? What's going on? So no one's going to do that. How many people are going to walk around with a big tourniquet on their arm and take it away? You know, it's uncomfortable. If you take the exercise and you take the tourniquet model, Fist Assist VIP, vein identification platform device. This device does everything that exercise and a tourniquet will do for you if you wear it, and it's safe and it's battery operated. And the bottom line is it's a wellness device for you guys.
What you think, T?
I like it. I like it because when I look at it, I imagine some of the old have some rice in there. So I think it'll be good for you.
Right. Wow.
So question, I'm sorry, Steve.
Go ahead, T.
Okay, could this help with Still syndrome?
Oh my God, T, you have got a topic there that is hot. Hot.
Uh-oh.
Really hot.
Yeah.
Because you're right.
We need it.
Think about this. 10% of the patients who have an upper arm fistula, that means above the elbow, whether it's a graft or a vein, 10% of those patients are taking away blood flow from their fingers and their hand. So they're getting DAS, dialysis associated Steele syndrome. How do you treat it? Well, you could revise the fistula, you could do surgery. How do you treat it? If anybody on this internet tonight is having hand pain from their fistula, take your other hand and compress your fistula. Just squeeze your fistula. Just squeeze it. You squeeze it, you're forcing blood down to your hand. Your Steele symptoms are going to go. That's when a patient of mine comes to my clinic and says, Dr. Singh, you did a great fistula. It's working well, but my hand hurts. I squeeze their fistula. They say, wow, the nerve pain is gone. Can you imagine, off FDA, I'm not talking about this because the FDA has to approve this. Can you imagine putting fist assist on your fistula, intermittently opening and closing your fistula to save your Steele? It's basically like those people who've got leg pain because they smoke. How do you treat the leg pain? Start exercising more. The more you exercise, the more collaterals you're bringing for your foot. Fist assist could be after some trials, hopefully in Fresno of all places, we could have a device here for Steele. Tamika, amazing question. You're already 7 months ahead of where we are.
Wow.
Yeah, I mean, because I can see it. That's why I asked, because if they're
wasn't
losing
even
blood,
thinking about that. Steele syndrome. I forgot all about it.
Because if it's
tonight we're
precedent, is actually on fingers. This is excellent. This is perfect because so many patients suffer from the winters coming, their hands get colder. This is really, really perfect. Damn.
We are entering a world for renal failure for the common patient. Steve, you've always been about, doctors don't do this. And believe me, there's a lot of good doctors and there's a lot of people that I want to have my mom see. Bottom line is, finally, I think we are entering a point, and unfortunately COVID has delayed a little bit of what we're trying to do here. We're trying to empower the patient with their journey for renal failure. And you know where it starts? It starts at stage 1, 2, and 3 with the most important thing. Take care of yourself, take your medications, protect your arm veins. Protect those arm veins. They're going to come in handy, very much so, for anything later in life. If you're over the age of 50, your arm veins are crucial. I would hope that people out there are taking care of their arm veins. Don't get trauma. Don't inject needles in your veins. Protect those arm veins. You're going to need them, guys. You're going to need them.
So, Dr. Singh, speaking of arm veins, let's just take a look. And sorry, Tamika, because it's going to probably cover your face.
Oh, no, it's okay.
But let's just take a look at this illustration. Tell us what's going on here in this picture.
All right. What you got here is probably some of the standard measurements of veins in the body. Now, I can't show it with a pointer, but I can use the numbers, okay? If you look at the lower wrist by 1.9 millimeters, 1.9 millimeters, that's the cephalic vein at the wrist. That's the vein we use for what we call a breccia fistula or a snuff box fistula. Ideally, you want that number to be around 2.5. Most people, 1.9. If you're a carpenter, maybe 2.6. I'm going to say this. I grew up on the south side of Chicago. I know this for a fact in my experience. African Americans will have smaller veins in their arms than the average European, Asian, Eastern European. It's just the way they don't either they don't dilate or they just don't get to the right size. So we have to think about that when we think of renal failure treatment for the African Americans in this country.
Hey, Dr. Singh, let me interject right quick, because you just said something that, to me, I could be going a little bit overboard, but it sounds like a setup, because you just said African Americans normally have smaller veins. If you know that, wouldn't other surgeons know that when you have a lot of African Americans going for access surgery? Wouldn't they kind of know that when they're coming in?
Steve, it's the capital E, educate. People aren't educated. If you're not, we talk about this, that the people who go to the vascular access conferences, the surgeons, I see them all, the same faces, those are the people who are really passionate about this stuff. Who should be at these conferences are the guys in the smaller cities of America who at the end of the day, oh, I got to put in a fistula. Oh, I just did a carotid. I just did an aneurysm. Now I got to do a fistula at the end of the day. Fistula work should be at the start of the morning, not at 5 o'clock in the afternoon.
And those are the type where you got somebody talking like that, more likely to fail.
Exactly. So let's go back to that you had a beautiful picture there. You got some numbers here that your audience need. So 1.9, that's the cephalic vein at the wrist. Let's go up to the elbow. You got a 3.3, that's a basilic vein. That's a good vein. It's a good vein. But you got that 2.7, that 2.4, those are good veins too. But you want those 2.7, 2.4, those are cephalic veins. You want those around 3 to 3.3. You hit 3.3 with those veins, you're going to get a great fistula. And we're going to talk about it.
Wow.
As you know, in the last 6 months, a new fistula has entered America. In America, 6 months ago, we had 3 types of fistulas.
We're going to bring that up.
Yeah,
go ahead. There we go.
There we go. Everybody needs to know about this. You need to take a picture of this. You need to have this on your background on your iPhone. This is when you go in for your fistula talk with your surgeon, you say, thank you very much, Dr. Vascular Surgeon, Transplant Surgeon. Let's talk about fistulas, and let's talk about the fistula you're going to give me. All right, let's go here. The first one on the top left, radiocephalic. I just talked about that. That's connecting your radial artery with your cephalic vein. You want that vein to be about 2.5. Then we're going to go the ulnar basilic right underneath that. That's very rarely done, very rarely used, and I'll tell you why. The ulnar artery is the most important artery to your hand. People don't want to mess with it. If you get into an accident, wait a minute, Steve, you get into an accident and your radial artery gets cut and your ulnar artery gets cut, everybody in the trauma bay is going to tie off your radial artery, but they're going to fight to keep your ulnar artery alive. Your ulnar artery is crucial to keep your hand on.
Wow. Is that what, when they do those type of fistula, is that where the Still syndrome or patients talk about not getting flow to their hands?
No,
dialysis?
You cannot get Still from a radial cephalic fistula. Let's jump over to the far right. Brachiocephalic fistula, that is a wonderful fistula if you got a 3.3 millimeter vein. Brachiobasilic fistula, you got to have once again a 3.3, but many times that's the biggest vein in the body, but it's very deep. And to bring it out, you got to make a lot of cuts to get it from a deep space to the superficial space so that needles can go into it. So I think the radiocephalic and the brachiocephalic are crucial. And if you want Still, it's either because of the brachiocephalic or the brachiobasilic or the big graft. If you got no veins, they're going to put the Gore-Tex or the bovine carotid, and that's where Still comes because your body is not used to having a 7 millimeter tube taking blood back to the heart.
Wow.
And Steve, the middle one, those 2 fistulas in the middle, those are the new Endo Av Fistula, which are basically non-surgical fistulas. You either use magnets or you use heat, and you connect the fistula in those areas. Very low risk of Still. Here's the problem. Many patients can't get those fistulas. Why? Because the veins aren't big enough, Steve. It all comes down to the veins.
I know somebody who has one.
Is it working?
Wow.
Yeah,
How did it work?
it's working. She lives in Chicago,
All right.
your city.
My city. All right.
Wow.
So she must have had good veins, and this comes down, and those are deep veins, whether the radial vein. These are veins that we never, ever really used for fistulas, and this is creative. So you look at it from the wrist to the below the elbow to the upper elbow. You got now a good 5 or 6 fistulas you can use.
Mm-hmm.
Wow.
But Steve and
So-
Tamika, what's the most important thing? All of these require 1 or 2 things that are crucial. They definitely require an artery. They better have a good vein.
Right. Wow. Now, let me ask you, Dr. Singh, with that being said, why is it that patients have 2 and 3 fistulas? If you just explain what you said, how do we get to 2, 3, 4 fistulas like that when they could have started with the best vein available?
So, Steve, I can't make a general comment there. We're going back to the topic of the surgeon. You need to go to a surgeon who does enough of these procedures. You know, if they're not doing 100 to 200 of these a year, you might want to start thinking, why are you here?
Wow.
Because the more experience, the better vein selection, the better surgical technique, the better outcome. And you know what? The better ownership of that fistula.
Mm-hmm.
I own my fistulas for my patients. Every patient I do a fistula on, I'm trying, and I don't have every fistula develop either. But I'll tell you this, every one of my patients knows I'm going to try to find the best vein, the best artery. And you know what? We've gone away from fistula everybody. We've gone for the right access at the right time for the right patient. A 50-year-old woman, may need a fistula, but an 80-year-old patient may just need a graft because you know what? The veins are so bad after 80 years.
I had a question. I wanted to know, so if you say African Americans have smaller veins, why isn't there like a special vein mapping just for African Americans?
Well, we're seeing more and more research. I will send Steve the paper that came out of Southern Illinois, southern part of California, where they talked about that in some way. You know, it's not just sometimes the dilation of the vein; it's the distensibility. Does the vein stretch open? Once you make a fistula, Tamika, that vein's got to start to dilate. It can't just stay small. It's got to get up to 5. So is there something in the genes? Is there something in the veins for a African-American vein that does not distend? Now, here's where it gets exciting. Then why are the athletes that are playing professional sports in the NBA, in the NHL, or Major League Baseball, why are those African-Americans having big veins? Is it because they're exercising more? Or is it because there's something in their environment, nitric oxide, which maybe some African-American patients need to start producing earlier to get their vein to start to distend? It's a very interesting topic.
But can it also be from dehydration, not drinking enough water?
So if you dehydrate yourself, your vein will go into spasm.
Okay.
And spasm means a small vein. If you take my vein and take me down to downtown Chicago in January, my vein and my wrist is going to be 0.8 millimeters. You put me in Jamaica, it's going to go back up to 2.2.
Right. And I'm only asking because the athletes, of course, they drink more water.
They're drinking water. They're pumping their arms. Usually you're an athlete. You're moving your arms. They're doing weights. They got very lean. They don't got a lot of body fat. They don't got a lot of body fat on their arms, right? And they're well hydrated, and they're in competition where it's heated. You know, they're in battle. Literally, they're in a battle with the game.
Right.
Yeah, guys, share this broadcast. I'm telling you, you're not going to get any type of information like this. Nothing. So, but Dr. Singh, let me ask you, the person who has a fistula for 20-something years, what are they doing to keep a fistula for 20 years opposed to someone that got to get multiple or having multiple fistula failures? What's the difference? I know everybody's different, but what is this person doing that's maintaining that fistula for 20-something years on dialysis dialysis opposed to someone who just start the first year and all of a sudden they get a fistula put in, they having all kind of access problems their first year starting dialysis?
So, Steve, it's a great question, and I have thought about it, and I think I got the answer for you. If you're going to start renal failure and need dialysis at the age of 40, okay, you're probably going to have a good quality vein. You're probably going to be very responsible for your health. You're probably going to get a fine surgeon to put a good fistula together. And you know what I think it is? You're going to take ownership of that fistula. And what that means is that, you know what? Nowhere in medicine do we make something on someone's body and then for the next 6 weeks start attacking it with needles. We don't do that on anything else. So when you go for your cannulation, you're going to take ownership that you're going to have the same nurse cannulate you at the same time Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, whatever your schedule. You're going to take ownership of that. You're going to take care of your fistula. You're going to have your family, your loved ones take care of your fistula. It's a combination of good vein going in, ownership of your fistula, good cannulation, and a 40-year-old person is still very productive, so they're going to exercise. They should be exercised. You put all these variables together compared to somebody who's had a very difficult livelihood, hardworking person. Now he's 65. Veins have been shot because of various traumas, and now all of a sudden they're trying to make a fistula work. They're at a later stage in life. They're not exercising their arms. They really don't know too much about what's going to happen with cannulation. A lot of my patients come to me. I tell them I'm putting a fistula in, and they tell me, well, what does that mean after the fistula is done? I said, well, needles are going to go in. They say, what do you mean the needles are going in? I said, that's how you're going to get dialysis. He goes, what are you talking about? Can you believe that? I'm in Silicon Valley, and they're telling me that.
So do you believe that they're not getting enough education prior to coming to you?
You got to be engaged in this process. You got to take ownership in this process. You got to be educated in this process. And it starts at stage 2, stage 3, stage 4.
Mm-hmm. Dr. Singh, can you just, well, let me just say, Linda, send me a messenger and I'll send you that picture that Dr. Singh sent me if you want to have that graph. But Dr. Singh, can you just distinguish the difference between an AV fistula and an AV graft for people who may not know the language?
Yeah, that language has got to be very clear with everybody on this global presentation tonight. AV fistula is a connection between an artery and a vein. It is your own tissue, your own vein and your own artery. And we've shown you 6 different versions of that. Those are all AV fistulas. The AV fistula is the gold standard for dialysis. It's your own tissue. It doesn't get infected as much, and it lasts longer. Every patient who needs renal failure care should fight for an AV fistula. Now, some people don't have the veins. Some people don't have the arteries. Understandable. So what we do next is we tell that patient, and sometimes it's a patient later in life who may have 5 or 6 years. You then say, you know what, why struggle with a fistula? Let's just put a graft. It could be PTFE, Gore-Tex, or it could be a bovine carotid, a cow's carotid artery. And basically what we do is we connect the artery to the armpit vein, and we put what we call a bridge, an AV graft. It is foreign material, folks. It is not your vein. It's connected to your artery. It's connected to your vein. But in between, it's all foreign material. Foreign material living under your skin, which is going to get needles stuck to it. Don't you think that's going to get infected at some point?
Wow. Now, how does that seal up? Explain that, like when a patient stops bleeding, does that Gore-Tex graft kind of reseals itself, or does that hole stays permanent at that juncture where you stuck?
Yeah. So if you wait 2 weeks after doing a Gore fistula or bovine carotid, it's already got epithelial cells and it'll all seal itself. They do make a self-sealing graft. The self-sealing graft has a different type of layer. So when the needle goes in, it's a silastic pop. You take the needle out, it covers itself. Now, the advantage with the self-sealing graft is you can use it in a week instead of waiting 2 to 3 weeks. Here's the other problem. The other monster in the room, the elephant in the room, is the catheter in your neck. While you're waiting for dialysis, while you're waiting for your fistula, you got this thing in your neck, the catheter. Get those things out as fast as you can. Those things, while they may make you comfortable, listen, if you're 95 years old and you're going to be unfortunately expiring, Christmas morning, and it's September 24th today, put a catheter in, live your life. If you're 40 years old and you got that catheter in your neck, you may get 1, you may get 2, you may get 6. The more catheters, higher risk for admission to the hospital, and eventually your veins going to shut in your neck, and you're going to get a catheter or a catheter-related stenosis of your vein in your neck here. Let's stay away from that.
Dr. Singh, talk about this.
Put that thing away. That's danger right there. That's danger.
I figured something like that could happen if people keep getting catheters.
Catheters are a big problem, folks. Big problem. You got a catheter, you got to start keeping a log how many times you've got that catheter touching your vein. The longer that catheter is touching someone's veins, it's going to eventually close that vein.
Now, talk about this, Dr. Singh. Wait a minute. There we go. About this catheter. What's the normal time that a person is allowed to have this in their neck, especially with people who have no more veins or no more places for access?
All right. If you're catheter dependent, then that's your livelihood and you need a catheter. As long as you, your family, and your doctor say you cannot get an access, you can't get an access in your arms, you can't get an access in your thighs, you are never going to get an access. You got to live with that catheter, and you just got to hope somebody higher than us, God, is going to not let you have problems. The minute you become catheter dependent, you are living with that thing.
Now, just explain the difference between this one and this one right here.
All right, so they're both very similar. They're structured in a way. Let's put both together. The one that's on. So this one right here is. It's basically they're both tunneled catheters that go under the skin. Their ports are kind of twisted in different ways so that they don't get involved in your groin. Maybe the one here that's got the bend is perfect for the groin. The one and the other one is perfect for your neck.
Right. This one, I guess it's the IJ. I seen them put it right here on the side.
Yeah, you can put that in the IJ, but look how bulky that thing is.
I know. I had to change people's dressing when it was right there to, cover their ear. Why would they put this in for quick access if they needed emergent dialysis, correct?
Right. So that's not a tunneled one. That's what they call a temporary one. I didn't see that. That doesn't have a cuff, right? It has no cuff on it. So that's a temporary one. 5 days max, Steve. Nothing more than 5 days. All right? Show me the other one that's got a little cuff on it. Show the cuff. A little bit lower, a little bit lower. Should have a cuff on it. Keep going down.
Right here?
Down. No, lower. Is there another one? Keep going.
No.
No cuff. No. So that's also a temporary one. So that if it had a little cuff, then it could go under the skin and the cuff keeps the bacteria away from it.
Okay. Wow. I just can't imagine having one of these in. I'm sure they're very uncomfortable.
Oh, they get infected. Every night you start getting fevers. You're going to be in the emergency room. They're going to say, oh, you got a catheter infection. That's why you want to have your veins ready, guys. Get your veins ready. Get your veins strong. Enhance your veins. All we're talking about tonight is arm vein wellness. Arm vein wellness. Our device, Fist Assist VIP, is the first America device for arm vein wellness. I don't know what you're going to do with when your arm veins are well. Maybe you get blood draws. Maybe you want to look good at your dinner parties that you got big, bulky arm veins. Having big arm veins is a good thing to have. There's muscle bodybuilders who can win competitions the larger their arm veins are. Look at this guy behind me right here. Look at his arm veins. All he's doing is working out, making big arm veins to win competitions. He's using the same kind of concept. Arm vein enhancement. Our device is coming to the market We think in October. We planning October on Amazon. Amazon.
How much is it?
$99, under $100, $99, battery operated. You get the box, you get the ball, you get a wristband, you get the exercises.
Wait a minute, show us everything you get. I didn't know you get the ball.
What you got? You get a box. You open the box. You get a beautiful ball which says Fist Assist, so you're a part of our team.
Mm-hmm.
You get all the information sheets. You get more information. This is the Canada version. You get the device, and get ready for this, Steve. You get something which you can walk around with at your dialysis center, which is the Fist Assist rubber band that says you're a part of our family. You buy the Fist Assist VIP, you join the Fist Assist family.
Awesome.
And so let me go ahead, Tamika.
Is there any way they can get like replacement parts? Let's say they lose the compression band. Could they order another one?
Anybody who buys it, they email me, they get anything free. I don't care.
Wow. So let's take a look at this. Can you explain how this works?
Yeah, so it's a simple device. So this is basically worn. This is in a perfect location below the shoulder. You can see the on-off button right there. Let's go back to me and let me show it to you guys.
Sure. Let me remove this. Okay.
Here's the device. You can see your arm would go through this. This is the control unit. Simple rectangular 3-inch control unit right here. You turn it on. You can hear it. You hear it?
Yes, it's pumping up.
Pumping up. It's a pumper right there. It's pumping up. You can't see it well, but this is going to go up to 30 millimeters of mercury, and it's going to hold for 30 seconds. You can see the light is on. It's flashing that it's in green. Batteries are strong. It's holding right now for 30 seconds. It's going to, you got to place this below your shoulder. Line it up with your thumb. Line it up with your thumb. The box, the Fist Assist logo, lines up with your thumb. Don't put it on your armpit on the underside. Put it right up here with your thumb. Look at my thumb. Thumb is up. The box is up.
Okay.
Don't be putting it down here.
Yeah, it has to stay up there where it's pumping the blood to push it down.
You got it. You're pumping it right up with my thumb. Thumbs up, box up.
Okay. Now, does it have a Velcro strap for someone who may have a large arm? What about people whose arm may be obese?
So right now, the present version, if you've got an obese arm, we are working on a band. Look at this band. Someone's got an arm that big?
Right.
Wow.
Look at that band.
So is the material similar to the blood pressure cuff material, or is compression?
Okay, so the material on the inside that touches you is a fabric which is much like, here it goes up again. You can hear it. Just went up again for another minute. So it's cyclic. It up and down. You wear it for 1 or 2 hours in the morning, 1 or 2 hours in the evening. The material that holds it is Velcro. The present version is perfect. If you have a light blouse and you put it on top of the blouse or a light shirt, it will stay on there perfectly. The new athletic band is designed like you can have, for the iPhone that you can wear, you wear the iPhone, you listen to music and you're running. That band is coming out in a couple months. Right now, the bands are flying. They're going to be changing. But right now, we want to get it on the market. We want to get people to appreciate a device that's going to help their veins. We'll work with them through Amazon. We're super excited. You could get this by Prime Amazon within 2 days after ordering it.
Wow.
Dr. Singh.
Wow. That's what's up.
I saw something in my Facebook watch party, a question or a comment. Someone said many people on SSD or SSDI might not be able to afford it. What would be your comment to that?
We're going to work. Obviously, right now, we're in a launch mode. We will do our best to help people. We will do our best to adjust the price. It is an economic play. We've been doing this for 35 years.
Right.
The investment in this company is a 35-year investment.
Well, you know what? Let me just say this. I understand people on SSI and SSDI, but at the same time, if I'm at stage 4, right, and if things doesn't look well for me, and I'm headed to stage 5, $99. I would rather invest $99 than have multiple accesses in the future. If it's going to save me from having multiple access failure in the long run, then I'll invest that $99. I don't want to be back and forth in those surgeon's office cutting on my arm.
You got it, Steve. And remember, and then go ahead, Tamika.
And then you keep going back and forth, back and forth, back and forth. Eventually, you have no more accesses.
You know, we're entering the holiday season. We've come through a main pandemic. We've had social injustice in this country. Got a lot of things going on. We need to take care of our arm veins. Our families need to take care of our loved ones. And if everybody's going to be driving back and forth, mom and grandpa and grandma, to the hospital to get more tourniquets, more blood draws, everybody with these big families needs to put in $5, $6 and help the loved one get through their health care. And it's really on. This is not a balloon that's going in the body. This is not bloodletting. This is not high risk stuff. This is arm vein wellness. This is all about getting your arm veins stronger so you can get good procedures. Think about all the chemotherapy patients, breast cancer patients getting blood draws, right? And at the end of the day, Steve, we're talking FDA, then we're going to start talking Medicare. So we got a lot of, we're not going to stop tomorrow. This company is going to keep going because we're in the business to help people with their arm veins. And the first, maybe the first 5,000, 6,000 people that buy this, it's going to help them. But I can tell you that momentum is going to help a lot of other people globally get this device.
Now, let me ask you, if someone has the wavelength right now, would this device help, or it doesn't matter?
Oh, man, Tamika was 7 months ahead with her steel question. You're about 8 months ahead. Man, that's a great question. So here's the deal. If you want a wavelength or you want an avenue.
No, what if they already have it right now?
So let me talk to two things.
Okay.
If you want one of those procedures, you better have a big vein. You need at least a 2 to 2.5 millimeter vein. So if you believe in my technology, you wear it for a couple months, hopefully your vein will get enhanced, larger, and be helpful. Now, here's the holy piece that the rest of the world is doing, but we in America can't say right now. The rest of the world is putting this on their fistulas in Canada, Europe, and a big amount in India. Because India, they got a lot of renal failure, they got a lot of fistulas, and people are putting this in. The Vascular Society of India endorsed this product. So they're putting it on fistulas to make their fistulas bigger. You wait for the day when the FDA says, you guys have done a great job with this, you've done great trials, let's start putting this on American fistulas. I'm not saying that today. I'm not going to say that in America's soil. But when I go to India, I say it all the time. When I'm in Europe, I talk about it all the time. When I go across the border to Montreal, I talk about it.
Wow.
Wow, that's amazing.
Steve, maybe we could have a fundraiser to get a couple people in.
To what?
I said maybe we could do a fundraiser, something online to help people get some.
Steve and Tamika, I'm going to send you guys 3 free ones. You auction them or you give them for a fundraising. You got 3 coming next week.
Awesome.
Oh, man. But we can't do nothing until you get clearance, right?
No. As a wellness device, as long as we say wellness, we're taking wellness. It's a powerful word. To me, wellness is the most important thing for this company. We are going. If you say to me that you got a lady or a patient on this internet tonight, on this global feed, which says, you know what, I really want to enhance my arm veins. We got the device for her. I want to stimulate my arm veins like an exerciser. We got a device for her. I want to strengthen my arm veins, Steve. I got a device for her. If you say, Doc, hey, Steve, I want to put this on my wavelength, I don't got a device for you today.
Right. I wish we could say it will help you with your Still syndrome and those words, and we have something for a lot of people. Because a lot of people are suffering really bad with Still syndrome. And instead of them getting another surgery, this can really help them.
Oh, Tamika, if you want to be the spokesperson for Steel in America, you're going to be very popular.
And the reason why I say that because I actually had a patient today. She's about 30 years old, and she just got her fistula. She was stuck about 6 times, and she was like, Miss Tamika, my hands. Look at my hands.
Absolutely. Absolutely.
Wow.
And she's noticing the color change and how they feel and everything. And I'm like, I'm so sorry, but this kind of comes with the territory. And she's like, well, what do you mean they didn't tell me this?
Yeah. We're excited. This is a long time coming to help so many people globally, some people more than others. But, you know, guys, Amazon has become a great partner to us. This device will be out there. I'll let you know, Steve, when it's live. Your customers, your fans, your promotions, all really a great opportunity. Arm vein wellness is stage 1. We got a lot of excitement happening in the next 6 to 9 months with Fist Assist.
Yeah.
Oh, that's awesome. Tamika, I'll let you decide how you want to get rid of those 3.
You're going to have to read inside the groups of the people that's really suffering with getting cannulated, because, you know, in a lot of groups, they share their stories, and a lot of them be horror stories of the technician missed my arm or my vein, and, you know, it swelled up. And just to go through some of those stories of the people that's suffering and asking them to maybe try this device.
Right. Wow. Dr. Singh, I mean, you graciously gave us an hour of your time. We know you're busy, and 3-hour difference. What can, before you leave, what can you share with the audience about their vascular system and how important it is, especially patients that may already be on dialysis or patients that may get ready to cross that bridge? What words of encouragement or advice or suggestion can you lead them as a vascular access surgeon?
So, you know, once again, Steve, you're such a great moderator. You bring these great topics that, you know, of course, could be a whole hour. But as a vascular access surgeon and a vascular surgeon and someone who advocates for patients with multiple medical problems, I'm going to leave one word, which I think is really going to be the word which you can apply to so many medical problems, but probably more in this country better than any other time. Hope. You've got to have hope. You've got to believe that you're going to take care of yourself. You're going to have a supportive family that's going to give you hope. Your doctors are going to take care of you. And if they're not taking care of you, there's a lot of doctors in this country that want to take care of you.
Wow. You
get diagnosed with renal failure, that doesn't mean it's the end of the world. I got a lot of patients hitting 85, 90 years old with renal failure. You got to listen to your doctors. You got to have a healthy lifestyle. You got to be physically healthy, mentally healthy, emotionally healthy. So take out all the bad people that are causing problems in your life. Surround yourself with people who are going to give you hope. Mm-hmm. Let them give you hope. Get through your treatments and get a good fistula. Use Fist Assist to get you there if you need it. If you tell me on the reviews on Amazon, Fist Assist gave me hope, I'm the happiest man in the world. And then if you got a fistula, take care of that fistula. Own the fistula. Protect it like you protect your family member. Protect it like you protect your eyes. Protect it like you protect your nose, your mouth. It's your fistula. Take care of it, and it'll give you hope.
Wow.
Thank you.
That's outstanding. All right, Dr. Singh, definitely appreciate you coming on, taking the time. We definitely look forward to having you back in the future to share your success on the Fist Assist device.
God bless you all. Take care of yourself. We will announce on your site when Amazon is ready to go. And for all those people out there, you know, just take care of your arm veins. It's the most important body part you got on those arms. Take care of those veins, and you will live a very healthy life. I'm a big believer in that.
Yeah,
absolutely.
Yes.
All right, Dr. Singh, take care out there in California. We know y'all dealing with some of them wildfires, so take care of yourself.
All right, take care.
Take care. So
all right. All right, take care. Bye-bye.
Bye-bye.
So that was Dr. Singh, currently vascular surgeon at El Camino Hospital out in California, CEO of Fist Assist, Devices LLC came up with this concept 35 years ago, Tamika, at the University of Chicago. And you know what I love so much about Dr. Singh is that he was down to earth, Tamika.
Right, right.
You don't get a lot of surgeons, you know, talk with you or even give you the time of day because they're so busy and, you know, they're on a different level. But he's just so down to earth. And if I had kidney disease and if I lived in California, he would be my surgeon.
Right. But Steve, he's also down to earth because he's from the south side of Chicago, baby.
Right. But yeah, but no, I mean, it's just a great guy, great human being to
he cares about what he's doing. And that shows you, like, when you care, it just something different about your actions when you actually care.
Oh, absolutely. Absolutely. So his patients are very fortunate to have him as a vascular surgeon. Let me tell you. And like I said, if I was a patient and if I saw this show, I would probably be jealous. If I lived in like Miami and he in California, I'd be like, I wish I had a surgeon like that.
Yeah, shoot, I may actually fly over there just to get the surgery and then come back.
Yeah. So I hope, Tamika, that a lot of warriors watching this show got a lot out of this. And for people who may have to go down this road and you want to maintain arm vein wellness, that fist assist device would be the way for you to go. Just try it. Right. I mean, nothing beats a failure but a try. I'd rather try that, Tamika, than wait to get to the surgeon's office and get cut on and your veins are not developed when you could have did arm vein wellness before procedure 6, 7, 8 months before that happened. You can already be ready when it's time to go.
Right. Or even if the doctors get them in the office and when the patients come, you know, just for a consultation or whatever, they're already prepping their arm. When they come, they sit there with a device on for an hour or two. Then they go home. Then they come back, sit with a device or two, you know, for a couple of hours to help actually mature the veins prior to surgery.
Yeah, and that's the thing. You could put the device on your arm. Let me just show it. There it goes right there. I mean, very small.
Right.
But the thing about it, if you put it on your arm, and I guess it could be programmed, you just leave it there. And you don't, I mean, it's not like it's going to squeeze your arm because it's going to deflate and it's just going to be like you have a little armband on, like you say, like the NBA players. And so that way you turn it on, you ain't got to worry about remembering to use a ball or to do the exercise because the device is already on your arm. I mean, that's genius.
Or someone that has weak hands, you know, squeezing that ball could be difficult. And this right here is a lifesaver.
Oh, absolutely. So again, guys, you got to do arm vein wellness. You heard it from Dr. Singh. That's the most important thing. And Tamika, I wish I could have asked them, especially for patients with diabetes, because I'm sure with their veins being diseased from long-term diabetes, would this device play a major role?
It probably can help. It probably can help. You know, with the circulation, you never know. Nothing.
But you know what? I wonder if he ever thought, as a vascular surgeon, making one for the leg. You know, when the patient, when they're, you know, when they can't get the blood flow down to the bottom, to the toes. I wonder if he could devise one, he could put it around the ankle and it could pump up. I wonder if that would help, but I don't think so because it's down below. So you would have to put it up, maybe up on your thigh something or below the knee. I don't know, but That would be a good idea if you can get more blood down to the veins in the leg. Prevent amputation.
Right.
So
he gave me hope because I've been on a project for a while now with the renal things, and it's like even though he started this a long time ago, he finally brought it to light. So it's like hope is not all gone.
Absolutely. Oh, you better tell somebody that.
Yes.
You better do that. And look, Lisa Baxter, I wish we still had Doc on. She had a fistula. Hers took 5 months to mature. Wow. I mean, he would probably say, like, what is going on with that?
Right. There's also another lady that was on here. She said it took 1 year for her fistula to mature. 1 year.
Yeah, we need to do in the future access show and talk just about access and access care
and holding the access. Steve, I don't know my patients. I'd be almost going crazy because they hold their access with one finger. And then they'd be like, my finger hurt. And I'm like, well, of course your finger hurt because you're going like this instead of gripping it like that, holding it.
Right.
Holding
right.
it. Not holding it.
I know.
Matter. I digress. Like Lisa said, veins matter.
Oh, absolutely. Arm vein wellness, guy. If you don't learn anything else from this show tonight, arm vein wellness. And you heard it from Dr. Singh, vascular access, renowned vascular access surgeon, CEO, creator of the Fist Assist device. He put 35 years into that. So that ought to tell you something right there on the love and inspiration and hard dedication he put into this device.
Yes.
Oh, somebody said theirs never matured.
Oh, wow.
Wow. See, this is...
I wonder if
we got to do another show.
Yeah, I wonder if he would have had a device would have helped.
Yeah, and one thing I forgot to ask is why do some patients, soon as they get a fistula, as soon as they get off the table, it clots up just like that. I've seen that happen with patients. They get back to the unit and their access is clotted. So
I don't know, but Steve, God has been so gracious and merciful to us, from where we started to now.
Oh, absolutely. A lot of people don't know, and maybe watching us, that we started off on our cell phones doing Facebook Live.
Yeah, dropping, and Steve would have to get off so I could interview someone, or I would have to get off so Steve can interview someone. And to have doctors from around the world or surgeons, come on and talk to us is I don't know.
Just like last week, we had the doctor from Nepal.
Yeah.
That was so awesome talking with him.
Yeah, just another version of what we have here somewhere else, and how what they do maybe can help us, or maybe what we do can help them.
Oh, absolutely. And I hope people are watching globally, because the Fist Assist device is already out. It's in Canada. He said India, Europe.
Yep.
And I think
Slovenia? Was it Slovenia?
Yeah, Slovenia, but that's the European country. But yeah, I mean, this is awesome. I mean, there's nothing out there like it. And Tamika, I'm just wondering, because he mentioned with the veins, let me show this one more time. This one right here. He gives the numbers on how large your veins should be, Tamika. Now, Tamika, logically, as a nurse, this is what I would be saying, right? If surgeons know that you're supposed to have 3.8 millimeter vein, depending on what type of access they're gonna put in. But if they know these numbers, and they gotta know because they're surgeons, that your vein should be dilated or that wide in order for you to have a great functional fistula, then why in the heck, when they do the vein mapping and then they tell somebody, oh, you got small veins? Well, why don't you tell me something to do to increase the size so that can happen, instead of just using me as a guinea pig and operating on me, knowing that there's a high probability of my veins stenosing or clotting. And now here I go. I don't know anything about it, but you knew in advance, you already knew in your mind as a surgeon that this is a possibility, but didn't say nothing to me. And like Dr. Singh says, it doesn't matter if you go there and if it works or it don't work. They still going to get paid. And it's not like, Tamika, it's not like you go there, right? And you get it done, and then you leave and you go outside and you feeling it to see if it working and stop working, right? It's not like you can go back in the office and say you want your money back.
Right.
They want to do another surgery that's more money out of your pocket, whether it's copay or whatever.
Right. Well, check this out, Steve. If they know that African Americans have smaller veins, why the HE double hockey sticks isn't there a specialized vein mapping for African Americans?
Right, to see where their veins how small they are before they actually do the surgery.
Exactly. If you know that African Americans have smaller veins.
Yeah. I mean, if research says that, then there should be something done to increase the veins so you don't have a multiple access failure. Or
right. And then, Steve, why are we just hearing about that African Americans are known to have smaller veins when we've been in the field collectively goddamn 50 years?
Well, I guess that's not something they're going to talk about. And, far as Dr. Singh, he's a surgeon. And they go to conferences.
Right.
I know.
We need to, for the patients to understand that because you're African American, you got smaller veins, it's a high possibility that this may not work.
Or let's try to do something to increase your veins before we actually start the surgery.
I'm about to do a virtual fight, like, ooh.
No, but maybe this show, if you're watching, if you're down south in Florida, Georgia, or wherever you are in the United States, because I don't know how they operate internationally, but if you're in the United States, and especially if you're African American and you living in one of those southern counties or whatever, where you're not getting a lot of education and they're kind of like fast tracking you in and want you to make quick decisions without, asking questions and really getting an understanding of what's going on. We hope this show gives you insight so you can take charge of your own health and make informed decisions based off of evidence-based information that you just seen from a vascular surgeon with 35 years experience. He's telling you. So
Steve, I'm going to do some research on their veins because I feel like I know what it is. I don't know. I got to get down to the bottom of it.
Yeah, do that, because this is crazy to know that African American already have smaller veins. So
I think it has to do with dehydration. I really do. And exercise. I swear on everything, because that's the only thing that separates the athletes. They drink more water. they're more hydrated, and they exercise, so they're getting their heart pumping.
Right.
A lot of the patients that come on dialysis, they're not athletes.
Yeah, I'm glad he said the more veins is better, because I do be doing some exercise, and I was like looking and like a freak show at one point. But if he say having more veins, because I can see these veins coming down my arm, and in fact, after the show, I'm going to do a little post workout. But if he say that's great, man, I want to keep doing it.
Well, I'm gonna start mine. Look, Steve, I got my gym, and
right.
I'll start working.
No, but Tamika, this was a great show.
Yes, it was very, very informative. Another eye-opening show that makes you, sit back and think about some things and how to maybe transform your life.
Oh, absolutely.
Differently, to have better veins. I mean, because none of us, even the ones that don't have kidney failure, are ones that can't get kidney failure. Like we don't escape kidney failure.
No. And I encourage people. This doctor created this advice that would give me motivation to try to find a niche to create something in the for the betterment of kidney disease. Patient. Maybe it may not be a fist assist device. Maybe it could be something to help patients stop bleeding, or maybe it could be like with Dax. I can't remember Dax's name, but the gentleman who has the IV clothing shop for kidney patients, Dax Francis, where he got the zipper and all that.
Don't forget Clothes Hip, the lady that she started making clothes for dialysis patients.
Oh yeah. So this is incredible. This is just incredible.
Mike also has a compression thing for your access too, to cover it.
Oh, right. Michael Smith.
Yes. Dialysis warrior gear.
Yeah. So guys, if you see something that you think you may want to do, this right here should be inspirational and motivation to come up with something that you think could make an impact in the kidney community.
Yes, and if you're a kidney warrior and you're an entrepreneur, we would love to speak with you, because we would love for you to encourage others to start something.
Oh, absolutely, Tamika.
Yes.
Absolutely. So, man, this has been a great show, inspirational, informative.
Yes.
All above.
Provide hope. Once again, he said that word, hope. It gives hope.
Yeah, and I'm going to tell you, he gave me hope, Tamika. And what I mean by that, when I first reached out to him a couple years ago, a year and a half ago, and he was so graciously came on our show. He didn't have to do that.
Right. He could have said no. Everyone could say no that comes on our show, but they don't. They have some faith in us. They want to come on and tell their story, and we're so grateful, and we thank you guys.
Oh, absolutely. So, Tamika, ready to call it an evening? Got an early morning. You back to work?
No, I have to take care of my mom, so I'll get up like I go to work.
Oh, okay.
Yeah, I get up about 2:45, 3 a.m.
I'll be getting up about that time. God.
So everyone, we want to let you know that your kidneys matter and your veins do too.
Absolutely. You couldn't say that enough. Kidneys matter and the veins. And you've seen that tonight, guys. So
everyone have a fantabulous evening.
Absolutely. Peace.
Good night.